Hello, everybody. It's the Bros Podcast. Welcome back. Today, I got my brother with me, and we're talking about a very, very controversial subject, euthanasia. Also, can be considered physician-assisted suicide. Um, but first off, I'll define those right after I introduce my brother, Korbin. Korbin, go ahead and say hi.
Yo, this is Corbin. I'm Beau's brother. I'm pleased to be here on the Bros Podcast, episode one. Absolute pleasure. Go ahead.
Absolutely. Thank you very much, Corbin. We're happy to have you. Today, like I said, we're talking about euthanasia and physician-assisted suicide. First off, I'll say the difference. So, euthanasia um, is the practice of a physician directly administering usually a medication of some sort that lethally kills an individual for a specific reason. Now, say someone's in a deep coma, or say they only have a few weeks to live, few months to live, and say they want to choose when to die. That is the question, basically. Um, and physician-assisted suicide is pretty similar, except the only difference between euthanasia and physician-assisted suicide is that physician-assisted suicide is when a physician prescribes medicine to an individual for them to take to kill themselves on their own, or yes, I mean, no sugarcoating it, kill themselves, right? I guess we can't really avoid using that phrasing in this podcast. But euthanasia, on the other hand, that is when a physician directly administers the medication. So that's the difference. But generally, same concept we're going to be debating right now because euthanasia is actually illegal in most countries. And so uh, recently, and for a long time actually, it's been a big question whether or not it should be illegal. And there are places around the world where it's legal. Even in the United States, there are places where this is legal. So we're here going to be having an informative discussion about the rights and wrongs, the morality, the effects, all of it. And we're gonna lay it all out. Hopefully, you guys can make your own decision off of our discussion. But yeah, might as well get right into it. Corbin, you believe that euthanasia and physician-assisted suicide should be legal. Is that correct?
In most in most circumstances, yeah.
Sure. All right. Yeah. And then I, on the other hand, believe that it should remain illegal. Um, at least in the United States. I mean, around the world, I believe there are reasons it should stay illegal, and so we'll be discussing that. First of all, I'll let you go ahead and describe the case where you would pick that this should be illegal or legal,
Legal. Okay.
right?
So it's in the cases where I think it should be legal. It's just like when somebody is suffering beyond the point of which you can say they have opportunity to get better. So obviously, in the case of a terminal illness where there's no cure, no treatment, the person is obviously suffering and living to suffer. I think that is a very valid reason to give them a right to die peacefully. At the end of the day, like you can't prevent any one person from killing themselves. Well, yeah, you can't prevent someone from killing themselves unless you put them in a straitjacket and lock them away. But assuming people have their liberties to live their lives normally, just like as a free citizen, you can't take away somebody's ability to kill themselves. But what keeping it illegal does is just takes away their right to die in a dignified and peaceful way. So anybody can go to Walmart, buy a bunch of Tylenol, and shove that, swallow it, and die from acetaminophen. But that's obviously a much less peaceful and dignified way of dying than administering something that kills you instantly, painlessly, and without suffering. And so that's why I think it's hard to argue against it being legal, just because at the end of the day, anybody can do it as long as they have liberties to go out, walk around, and buy something from the store. Um, but in a peaceful and dignified way. Um, Having
Yeah.
that be illegal is, yeah.
Yeah,
Go
no,
ahead.
I totally understand your point, and that's a very valid argument, and I respect your view on this, and I can tell that you're doing this, you hold this view for very positive reasons, and like you said, dignity, I can really understand that part, because yes, absolutely, there is um, uh, kind of a stigmatism around this kind of subject, and when people, of course, commit suicide, they are looked down upon in our society or in some way, and they lose that
Mhm.
dignity. So I completely understand what you're saying there, and this is definitely a more dignified way, and I hear that in quite a few arguments for this to be legal. And really, you brought up a big point here about it being specific cases because
Mhm.
there that's one of the biggest questions here, because we can't just allow everybody to kill themselves when they choose. Or what would you agree with that?
It's a very hard line to draw because obviously there are, suicidal ideation is very prevalent in today's society. Like
Mm,
obviously there's a lot of people who have um, you know uh, breaks in their life where they want to die even though their life could get better, and it's hard to say like, oh, everybody should be able to do it whenever they want. Obviously I don't agree with that because you know I've been suicidal at some points in my life, and um, I don't think it was the right decision for me to make. um, and obviously I didn't do it, me talking here right now, but like um, yeah, it is really tricky because you can't just give everybody just like the immediate access to death because there's a lot of people who would do it on um, what do you call it? Just like on a quick, what do you call it?
on a
Like
whim,
yeah, just like uh, a very like I
a
can't think of
rash
the word.
decision,
Yeah, just like a
just
really
quick,
like you're yeah,
right?
yeah, you know what I'm talking. There's a word I just can't think of it,
Yeah,
but
absolutely. I
yeah.
completely understand your point, and I'm sure our listeners will too. And yeah, I absolutely hold the same position there so far. I think individuals should be protected from themselves in situations like that where they could be making a rash decision about their life. And I think many people have been in the same situation as you and I, including, have been in where we consider it and then we're very glad we didn't go through with it. So I'm glad we established that it shouldn't be allowed in every case. People shouldn't have the right to decide to kill themselves per se. Although you did bring up the point that anybody is pretty able. Everyone's very able to kill themselves
Correct.
if they so choose, right? So but there are a lot of implications with allowing this and um, putting this into law. And so you say that in cases where people are suffering, when people know they are going to die, and when they choose it, then it should be administered typically.
Yeah, like I mean, in like in the case of like ALS, 100% fatality rate, your life deteriorates. At some point in ALS, like at the final stages, like the only thing you can move in your body is your eyes, and I think that's hard not only for the person with ALS, but their surrounding family and friends who have to witness that. And I think at that point, a peaceful death, before that point when it's inevitable anyways, is the more favorable option to watching that happen.
Sure, yeah, yeah, and that's a good point. I've seen a lot of family members kind of advocating that for family that they are just watching suffer, which can be very hurtful on loving members.
Hmm.
And but also on the other hand, I'm sure there are plenty of, if not even more cases where the family actually disagrees and doesn't want someone to go through with it, even though that person themselves would wish it. And so, should the feelings of the family be um, uh, should the emotions of the family members
Be considered.
right considered. That's the word. So yeah.
I think they should be considered, but also it like I think that in a lot of those cases where the family thinks that it like they don't pull the plug or whatever, I think it a lot in a lot of cases it's done for selfish reasons and not with the consideration of the the person in mind. Um, like in the case of like an ALS, you know, like the example I gave, if there's family members who say no, I want them to live it out till the end because I don't, for whatever reason they might have. I think whatever reason they might have for that would be a selfish reason, and I think the agency should be within the person whose life it's an argument of. Like you're, I don't know, like it is tough to say that um, just because the people around them are hurt. But I mean, it it is. I think it's just selfish. Like if in that case, in the ALS case, where it's obvious, like there's no denying that the only reason that this person is alive right now is a to suffer and b to keep the family like hopeful or whatever you want to call it, like um, happy. Like I think that's just I think it's selfish.
Mhm.
Yeah, I don't know what to add to that.
Sure. Yeah, no, I absolutely understand your point of view there, and selfishness is a word used pretty commonly around the topic of suicide, and it really depends on the case here, and I'll talk more on that in a minute, but yeah, I would say that in some specific cases, it could also be seen as selfish to kill yourself as the person asking for euthanasia or
Hmm.
physician-assisted suicide. And of course, that depends on the situation, how much suffering you're going through, um, and so on like that. And that's why it is so difficult to draw a line here. And that's actually why I've chosen my point of view, is because I believe this line is too difficult to draw. And once we draw that, there will be far too many implications socially and just a lot of adverse effects could happen on our society because of this. And just that reason alone doesn't mean that it should stay illegal. Of course, there are things that plenty of people have thought that once it was legal, it could end up badly when really it's the other case around. And so, it could end up being a very good thing that it's legal. In fact, in some places around the world, it is legal, and there's actually been quite a bit of research done on euthanasia because of how interesting of a topic it really is. Oregon is a state in the United States where it is legal, and they've done quite a bit of research on it. And at first, a somewhat lower percentage of the population of Oregon would have voted to legalize euthanasia, but nowadays, an even higher percentage would have voted for legal euthanasia. So it seems like it's garnered more and more support as it's been legal. Um, so yeah, it does seem that there are positive effects. However, there are also many negative effects. We've discussed, the suffering of an individual, and like you said, ALS, many cases, people can be in very difficult suffering, um, and euthanasia could be, their only escape from this suffering. And especially when they already have a deadline on their life, it can be very empowering to be able to choose that deadline. And and so, but on the other hand, I'd like to bring up the effects on the people that this also affects. For example, the family and the physicians, the medical staff. Those are the two groups that I feel like are most impacted, other than the individual themselves. And and of course, I think the order goes individual, then family, then physicians. Um, so of course the individual is affected the most, and that is a very good reason why they should have the choice. However, since this affects many people in such a deep way. It's important to consider their feelings on this, and that's why I think family consideration is somewhat important, whereas it might not be the end all be all, where I don't think the family should exactly have the choice there in front of them. But um, we should also consider the effects on the medical staff because it has been reported that this can have adverse effects on the
The
physician.
administer, yeah.
Right, exactly. And if you think about that, that's quite the role to take on as someone to take the life from an individual, be an executioner like that. And of course, no medical professionals go into the field looking to do that, unless of course they are sociopaths. But 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 yes, this can have a very rough impact on them, and I feel like a rough impact on society as a whole because, again, how difficult it is to draw the line. So, in the process of legalizing this, do you think, you know, uh, legal professionals and doctors alike should work towards discovering which cases or diseases that this should be allowed for? Because right now in Oregon, let me clarify, right now in Oregon, um, I believe two separate physicians must review the case, and the person must be dying within a few months. And so that's a reasonable system to have physicians analyze each case. But if we are going to widely legalize this, there could be a lot of cases in which people might want this, and maybe physicians won't be able to view it all, or maybe they will. So, do you believe that doctors and legal professionals should go maybe disease by disease and set out specific guidelines, or do you think that they should stick to that where professionals review each individual case?
Um, yeah, no, I like how they have it set up in the U.S. I think it might even be a little bit too strict. So in the U.S., it's like specifically for terminally ill cases, and then I do believe in like other countries such as like the Netherlands, it's also extended to psychological disorders like depression, PTSD, severe cases of autism. Those are all reasons that um, assisted suicide is administered in that country and others in Europe, I believe. Um, but no, yeah, I totally agree with how we have it set up in the U.S. and I think it could even be a bit more lenient on who to administer it to. Um, Reasons for that, I mean, yeah, like I think it should be on a case by case basis. I don't think it. Well, well, can you clarify your question a little bit? So, like you said, it's either done on a case by case basis or it's done by a specific list of diseases. Um,
Right, yeah, I was more generally trying to ask where exactly that line should be drawn, if there should be specific regulations for each kind of disease, and maybe there should be a regulation that says the person must certainly be
I
dead in
mean,
3 months, for example.
it's so hard to like. I don't even know if there should be a line drawn for that.
Mm,
Like, um, an example for ALS again. Like, all right, so once they can't move their arms, it's okay, or no. Once they can't move their arms and legs, okay, there. That's like I don't think that's a really good way to do it. I think that should be left to the individual who's suffering from it. Um, and I guess it could be done on like a disease list basis, like you're saying, where like, okay, if you have this disease, you should be able to choose when you die. I think that could be a good like good guideline, I suppose. But yeah, like you're saying, it is really hard to just to draw that line. Yeah, I
absolutely.
mean that's the hardest part about it because like at the end of the day, like it's really hard to argue against like all cases. Like if somebody like it is so obvious in some cases, like okay, death is the best option. Like having a peaceful death for this person is so much better than letting them suffer right before them. their families and the physician's eyes, it is just infinitely sadder to see somebody slowly suffer and wither away than it is to let them drift away peacefully into the inevitable. So
Mm. Yeah, and I absolutely wholeheartedly agree with that. And I think there are definitely situations in which this is beneficial. But on the other hand, the reason I have came to my conclusion, of course, is because exactly that line is so difficult to draw, and I feel like the implications are an important thing to discuss. So, for example, one implication could be uh, what's that word when someone coercion, there it is. Yep. So coercion, for example, that's a big implication. Family, physicians, they can have very big effects on people mentally, especially when they're in the hospital, when they have a disease. For example, people always respect authority figures. And of course, doctors in our society are huge authority figures. And right now, there are actually pretty good laws in place in Oregon to prevent coercion. Uh, one of which doctors and physicians are not allowed to bring this up as an option to patients.
interesting.
Patients have to bring this up to the doctors actually, and so that's a very good step in the right direction to avoid coercion. And then but I believe that is a big implication because that can lead to some big problems if there is coercion. Perhaps, if a physician did offer this as a option to a suffering individual, that could land that physician or that doctor in a lot of trouble for that coercion, leading someone to take their own life, and
True.
coercion by family, and this can have big effects on people after they have made that final decision to be euthanized, and those social effects are very huge, and you know starting to step towards legalizing this, if we envision a world in which the United States is fully legal with this, um, I would say that there would be many cases where this could be used, and maybe that's a beneficial thing. Um, However, uh, because of the implications, I feel like that world um, is not. I feel like it's very theoretical. And I feel like theoretically, this could be such a great thing, and it could really help a lot of people that are suffering. However, because of implications such as coercion or the effects on family after, um, you know, s- uh, think of a case where, you have a close family member that's very, very hardly affected by this, and there could seek legal action where right now, legal action is very up in the air. Of course, this is a theoretical uh, situation anyway, but there's legal action that could implicate a lot of individuals because this is life or death, and because the individual who chose it would be dead afterwards. They wouldn't be able to be there in court or anything like that. As well as you know taking your own life can be very hard on family members, very, very hard. Some of the most difficult things on family members, and you hear about many cases where suicide might actually run in families, mainly because of the fact that if one individual in a family commits suicide, that can have such damaging effects on a family member that that it could lead them into a similar vein of depression that leads to awful choices such as suicide. But um, you know, we can imagine a world where this happens quite a bit, and I feel like the family could take it very wrong. There's a big difference between having, say a brother, sister, cousin, they could choose to die in a case where they are suffering, And maybe that is a dignified way and maybe you respect it. Or on the other hand, maybe someone's family member chooses to do it and that family member doesn't agree with it. They wish they would have had more time with them. Those last few months, people can always wish for another hour. People can say they'd kill for another hour just to be with that family member they've lost. And that can very hard that can be a very hard effect on family members.
I I think that's selfish though. When
Sure,
the person who is suffering, I think it should be up to the person who's suffering. It's their life. It's not the other person's, and it's not the other person's place to um to know or to have. Oh man, what am I thinking of? It's not the other person's it's not the other person's place to say like if they're suffering enough or not, or if they should live another hour or not. I think that should be left to the individual, especially in cases where suffering is almost guaranteed to be the only path forward in their lives.
sure. Yeah, yeah, no, that's a very understandable point, and I agree that there is a degree of selfishness in there. And then I will also bring up uh, the issue of this possibly being a slippery slope, as laws can sometimes be. And once that line is drawn, of course, there could be later legal interference to keep drawing a line until it's a more perfect line, and that's just the case of trial and error and
Hmm.
perfecting laws. Um,
No
but
less perfect, but
of course, um, and uh, and yeah,
I don't know. Like, I do you agree that like in the case that I brought up, like ALS, 100% fatality at the end of it, all they can do is move their eyeballs. Don't you think it's more beneficial or like favorable for them to be able to choose when they die, as opposed to forcing them to live out on a breathing machine and have family, friends, doctors, and themselves have like experienced that, or like just watch them slowly deteriorate into something that isn't even recognizable from the person who they were before. Don't you think that they should have the right to have that agency to decide when they die?
see, and that's exactly where I kind of
Just a yes or
differ.
no.
And right, yeah, well, I actually do. I do.
Okay.
Except I think it's different between it should be right and it should be legal. Um, because I
Mm,
agree in a case like that, um, it does seem only right for an
okay.
individual to have that choice.
What's a hypothetical where you think that it's like up in the air, or you think that you'd lean more towards your position of they shouldn't have that agency or that choice?
Um, I'd say, I'd say there can be a lot of mistakes in decisions like this. And for example, I know an individual, a close friend of mine, who, doctors said he'd be dead within a few years of being born. And now he's my age, and he's still living and he's still going on. But uh, but yes, of course, doctors can make a mistake, whether that person will live or die within the next few months, and that kind
Mm.
of decision can haunt people. And like I said, family members and physicians alike, taking life from someone is a very permanent choice, um, and the permanency of that, the mental effects of that permanency can be very diverse.
Mm-hmm.
And in that way, a lot of family members, even if doctors were 100% sure that that person would die within a few months, there's always going to be doubt in people's
But
minds, and they're always going to wonder, what if they were still around? And
I, I don't think the question is whether or not they're going to die. I think the question is whether or not they're going to suffer, and there's no alternative to that suffering. Does that make sense? It's like in the
right,
case of like your friend who was expected to die within a few years. Like I think that they should they shouldn't have that immediate access to die if they're not going to suffer for those entire years. If there's an alternative to suffering, then I certainly think they shouldn't, be administered euthanasia or given that choice so freely. Like in the cases of like cancer patients who obviously they do suffer to an extent, but at the same time, like they can live quite a few years before it gets to the point where it's not um, where the suffering becomes unbearable. And
Mm-hmm.
I assume that in the case of your friend, like they weren't suffering you know their whole lives. Obviously, like I would assume that that suffering went away and there's an alternative to that suffering. Does that make sense?
Mm-hmm. Absolutely. Yeah, yeah, and that's a very good point. I like your distinction there between not exactly what time they will die, but if they're suffering, and that's a very important distinction in the subject. And um, and I feel like that's another really difficult line to draw because we
Mm-hmm.
all face suffering daily,
Mm-hmm.
daily even we all face
Life
suffering.
is suffering.
Right. It is absolutely prevalent all throughout everybody's life, and of course we cannot feel other people's suffering. So it is fair to assume that that is a decision up to them. However, because of the fact that we all face suffering and how difficult of a line is that to draw between, such crushing suffering that they need to choose death or, daily constant suffering such as back pain, which you know many people deal with, and they do not have the right to choose death over back pain. Um, but um,
Yeah. It
but
is tough
yes, absolutely.
though. Like going back to what I said, like a person with back pain, they can choose when they get to die. They can go to Walmart and buy a gun,
Mm,
or they can choose. It's just whether or not we decide to give them like the what do you call it the faculties or
mhm.
the resources to do it in a way that's not suffering. I don't
Sure.
know. And obviously, like, having it legalized and everything, it almost looks like you're encouraging it. So I,
Hmm.
I I think that relates really well back over to like the war on drugs. So like if you legalize drugs, aren't you encouraging people to take those drugs? Since you're saying it's okay or like, it's we're not going to persecute you for doing them. And I just disagree with that whole like line of thinking or philosophy.
Hmm.
I think that at the end of the day, people are going to be able to kill themselves. People are going to still be able to do drugs. It's just like whether or not you're giving them safe, routes to do them. Like and yeah, I like saying that legalizing something is an encouragement to do it. I think there is an argument for that, but I don't think it's a very strong one. I don't think it works out in the end. As demonstrated by the war on drugs. I mean, the war on drugs is not is a failure in almost all senses. But yeah, I think that's a good comparison to draw. Is like at the end of the day, we all have access to this. It's just whether or not it's safe and reliable and dignified ways of having access to something.
Mm.
Um, yeah, I don't know. Go ahead.
Yeah, yeah, no, absolutely, and I'm glad you made that distinction right there because yes, absolutely, people always have the ability to commit suicide, and so I guess the reason suicide in general is illegal is not so that people are unable to do it because
Mhm.
of course people can do it if they
It's
choose.
so that like authorities have the right to intervene, like so that
Right.
if you call the
This
cops and say somebody's trying to kill themselves and like if it was legal, then they couldn't legally do anything about it. But if
mm,
it's illegal, then they have the right to, or they have the authority to step in and do something. Yeah.
right. Very good point. Yeah. Absolutely, that is true. So that um, officers have that ability, but also the point I was trying to make was that it's a law so that we could protect those individuals um, generally, because like we've discussed earlier, many people make that kind of mistake where in fact they could reach a better happiness later on if they had given themselves the time, but
Hmm.
But yeah, so um, suicide being illegal as a whole is to protect those individuals and protect them from doing harm to themselves. And so, I guess, whether this should be legal or not for euthanasia, we should practice the same kind of thing. And I like how you bring up the point of dignity and safety because yes, you know, legalizing this will allow this to be safe and dignified, and so there are a lot of benefits for that, and I suppose in the situation where they are faced with very difficult situations like that, I would say that people are still capable of making a mistake. Um, However, I completely understand your point of it being a safe and dignified rather than, complete suffering, people seeing themselves as nowhere to turn, and they commit suicide, and then their image is uh, disformed for, eternities per se. But yes, I suppose where we disagree is that I still think people can make a mistake, and I feel like people should be living until they absolutely can't anymore, and I don't
Mm.
think people should have that choice no matter where it goes because I feel like there is still room for error and there are still ways mistakes can be made, and the permanence of decisions like these is exactly why things like the death penalty, not to go on a different subject, but for example,
No, go ahead.
the death penalty, for example, people, it can be a mistake. People can be killed
Mm.
and then later evidence found against them. And of course,
I
this isn't quite
I
the same.
I totally agree with that. I think that the death penalty is unjust because, like you said, new evidence has, it's happened several times in the past where new evidence is brought up and like, oh, we just killed an innocent person. That's why I agree that the death penalty is flawed, and I don't
Mhm.
necessarily agree with the death penalty because of that. I certainly don't think that the way that we do life sentences is very good. I mean, we pour a bunch of money into that, and well, and also actually we put more money into killing people for like doing the death penalty than locking them up for the rest of their lives, which is strange.
Mm.
But no, I agree that the death penalty is unjust because of new evidence. But I think the big distinction there is that new evidence. There's a difference between
Mm.
between that and euthanasia because in euthanasia you know that the suffering is inevitable in the cases of like ALS or stage 4 cancer patients. you know it's been proven, it's been shown that the suffering is inevitable. There's no other route other than suffering. There is no new evidence. I mean, okay,
Mm.
okay, you could say that like, oh, but you could keep them alive just in case like there's gonna be a cure for ALS that comes along. But I think that's a far stretch. That's a
Mhm.
way different possibility. That's much less likely than new evidence in a trial being brought back.
Mhm.
Um, so that's why I don't think that's a the best comparison to bring up the death penalty in comparison to euthanasia
Sure.
because new evidence is like a very like likely and um, well not very likely, but it is like definitely a bigger possibility than finding the cure to cancer or ALS. So
Right. Yeah, and that's a good point, but I'd actually disagree, and I think where my point lies in this similarity between the two is not so much, I guess, evidence really isn't the word, but mistakes more like. And since this is such a highly philosophical question, I'll implore another uh, philosophical idea, and that's that nothing is certain, and that's very highly used in all of philosophy, and it's widely believed between famous philosophers. Is nothing is certain, and new evidence, I feel like isn't so far different than mistakes, and I feel like you said, in these cases of euthanasia, people 100% certainly know that they are going to die or that they are going to continue to suffer, when in fact that's what everyone thought in court, and that's why person would be sentenced to death, is because everyone was certain. But that new evidence, there's mistakes, and there's mistakes in the choice of euthanasia, and there can be mistakes in court, and I believe the permanence of this situation is the reason that there are just so many implications that a life, a permanent a decision over a life. There could be too many mistakes and too many problems could arise from it, and drawing that line is just too difficult. And there could be a
I think
lot of court cases and a lot more hurt people because of this.
I think
And
also like a big distinction that should be made is that we're talking about whether or not somebody is deserving of death, and whether or not somebody should have the choice to end their own life. I think
mm,
that is a huge distinction that should be made between the death penalty and euthanasia. Is that um, in one case you're saying that this person deserves to die, and that is why we're sentencing them to death. And also, like, in the death penalty, like, courts never, I mean, in very rare cases, like, fully agree. Like, most court decisions are split. And
mm,
so it's hard to say that, that's, I think there's a lot less certainty in the death penalty and death sentences than there is to the suffering of a person due to a degenerative disease.
mm, right, yes, I absolutely like the point that you
Obviously,
made.
nothing is, completely certain. Nothing is certain, but I think there's levels of certainty,
Sure.
and there's much more certainty in the euthanasia degenerative disease point than there is to whether or not somebody is deserving of death due to a crime committed.
Yes, yeah, absolutely. I like that. I like that point you made between forcing someone to die in the case of a death penalty and someone choosing to die. Um, that is a very big point. And to that, I'd just like to draw another connection between the current laws of suicide, and that's to protect people from making those mistakes, because people can make mistakes about if they would like to die or not. And yes, I completely understand why this is a controversial issue and why this should um, why this is considered, and it should be widely considered. It should be widely debated, and everybody should share their points of views with this, because more and more now it's being talked about, and around the world there are many places where it is legal, and so it's an important discussion to have, and it's humane, and I could totally understand all the benefits that someone could receive due to this. The dignity, the release of suffering. Absolutely, it could be used in so many good ways, and I feel like legally, the implications are too deep to to put this into law. But really, I want to thank you, Corbin, for coming on and sharing your views. And I'd like to ask you if there's anything else you'd like to add to this before we wrap this up.
Um, um, I don't know. Yeah, I think your life is your choice. I'm not gonna say my body, my choice. I think that is. I don't think that works in all cases, but I think your life is your should be your choice. And it is your choice. I mean, you can you can kill yourself if you want to. I mean, if you hold your breath long enough, and
Mhm.
well, I mean, I don't know. You can put a plastic bag over your head. You can go to Walmart, get a plastic bag, and put it over your head. But obviously, that's gonna you're gonna hate that. I mean,
Mhm.
that's going to be not so painless and dignified. So I think having the facilities to end your life, and I think there should be safeguards in place. So like maybe mental health checks, and like I think there should be a little bit of oversight as to when to have access to these facilities. I'm not disagreeing with that, but um, in terms of not having the right at all to these facilities at all, I think that's unjust. I think that is immoral, and I think people should have agency and agency over their own lives. I hold a lot of libertarian ideas. I'm a big believer in liberty. I wouldn't consider myself a libertarian, but I would say that's like where my viewpoint comes, is just like having the liberty, agency over your 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 life. Um, I think everybody should have the right to live, and I think everybody should also have the right to die, and I think that's just the right of life. So, yeah.
Yeah, absolutely. Yeah, and these are very, very valuable opinions from my brother Corbin here, and I'm very thankful he decided to come on his podcast and share them with us. This was a great discussion. We've laid out a lot of points, and maybe we've even changed each other's mind in some aspects of it, but overall, it was a productive discussion, and I'm glad that you guys are here listening to this podcast. So once again, thank you very much, Corbin. Thank you for coming, and I'll see you guys on episode 2.